Hi, I'm Dr. Vernon Rowe, head of the MidAmerica Neuroscience Institute. Patients sometimes ask me or say to me in disbelief, I can't believe I didn't have to wait for 3 or 4 months to see you or to see someone in our institute. And I can't explain why wait lists for neurologists are so long. I know that there's a great need for neurologists in our subspecialty culture of medicine these days. I know there aren't nearly enough, and there are not enough in the training programs. But it seems to me it's more of a scheduling issue and a prioritization issue than anything else why these waits are so long. What we've done in the MidAmerica Neuroscience is realize that when a family physician or other or internist or other primary care provider decides that a patient needs to go to a neurologist and knows that patient is going to have to wait months to get into a neurologist, we know that's not good patient care. It's not good patient care for the patients themselves. And it doesn't really help the whole system of getting patients fixed and on with their lives. So we've set up a different scheduling procedure here at MidAmerica Neuroscience, and that is that we make available, we always have available slots for experienced clinicians to see patients every day of the week. So that patients who have intractable headache or have a new kind of headache or think they might have multiple sclerosis or are worried about a loved one having a memory problem or have been told that they're falling asleep and their spouse or they are worried about a sleep disorder or they have bad neck pain or back pain or a new numbness that they have not experienced before, or weakness. We have slots available for those patients to see because we've just planned it that way. I don't know why everybody else doesn't do that. I think it probably has to do with just an appreciation of how important it is to see patients who are having these problems in a timely manner. So that's at least one thing we can say about MidAmerica Neuroscience, that we can evaluate patients rapidly with many of the problems that neurologists that drive patients to neurologists. Now, this is not to say if you have the acute onset of stroke symptoms that you should not go to a hospital. You should go to a hospital. You should seek out a hospital, emergency room that has a stroke program. But you should definitely go to a hospital if you even think you might be having a stroke, or if you definitely are having a stroke. You know, because you've had one before, or someone close to you has had one. Again, those warning signs of a stroke: sudden onset of loss of vision in one eye or the other, sudden onset of double vision, problems walking, sudden onset of weakness or numbness of an arm or leg. All those things should drive you immediately to a hospital emergency room with a stroke program. But the other problems now have to wait for months to be evaluated in a neurologist's office. We get patients within 3 to 4 days.